supposed to wait for you your data.
Since March 2020, government has so far provided over 4 trillion shillings towards the COVID-19 intervention. Of this, 314 billion was provided in the 2019-2020 financial year, 2.7 trillion in the 2020-2021 financial year, and in the 2021-2022 financial year, 932 billion has been provided. After a month of probing, the Parliamentary Task Force on COVID-19 pandemic has found inconsistencies in how these funds were utilized by ministries, agencies and departments. The committee report indicates that all the government stimulus packages intended to cushion the public against the diverse economic effects of COVID-19 have not reached the intended beneficiaries.
The committee further recommends that government should halt the provision of any form of stimulus until the Auditor General conducts a forensic audit on all funds that have been appropriated for COVID-19 response.
The stimulus packages included 558 billion in the Uganda Development Bank, SACCO's 77.7 billion, Youth Fund 130 billion, Women Fund 29.5 billion, and Emyoga 260 billion shillings. The report cited lack of a transparent mechanism in ensuring that the resources trickle down to the intended beneficiaries. The committee led by Bugweri County MP Abdu Katuntu further faulted government on prioritizing COVID-19 containment measures with 142 billion compared to funds so far allocated to COVID-19 vaccination procurement. In the 2019-2020 financial year, 22.1 billion shillings was allocated for the establishment of 20 isolation centers. However, the committee found out that such centers were never established.
In future, when we have this kind of pandemics, we needed to apply a bottom to top kind of dispensation. Aspects like regional hospitals should have played a much bigger role than they have been playing in this fight against COVID-19.
PPDA processes were faulted. All the required processes of spending the money to the required or appropriated initial entities were equally faulted. You don't hear about the detention centers, or you don't hear about the procedures for procurement of all this being followed.
A further look at the 94 billion supplementary budget to the Ministry of Health in the 2019-2020 financial year showed that the ministry actually spent 4.8 billion shillings in excess of this budget, raising questions on the source of the excess funding.
We want to ask government that the recommendations that we have made in our report are in good faith. Let the recommendations be implemented so that we are prepared as government, we are prepared as hospitals in the event of the attack of the third wave.
On the face masks, the committee report indicates that 1,214,202 masks of the 37,916,250 masks were never procured. Yet of this, government provided 88 billion shillings for this procurement.
So we have seen a lot of money being allocated to many other things. They say masks, they say what, yet there are those essential things that we want the government to put eyes in it. Like, for example, if you can see, if Kapchorwa Hospital is given an ambulance, that is how we can save the lives of the people in the sub-region.
I support that audit. It is the one which will inform us, and on the floor, on the debate floor, we shall decide what action to take. If money was misused by people, then the law will take course.
With these discrepancies, the task force has now recommended for a forensic audit by the Auditor General.
Whatever findings that they've gotten are findings about our people down there. There is nothing political, and I want us to embrace that report.
Habad Ziwa, NTV at Parliament.